Good afternoon. Welcome to the first official meeting of the Assembly Committee on Health and Human Services for the 83rd Legislative Session. I am Assembly Member Tracy Brown May, and I have the honor of chairing this committee. Very excited to be here with you today. Secretary, will you please call roll?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadeem, Wynn, Orentlicker, Chair Brown May.
Thank you for that. Would you please mark our members present when they arrive? Thank you. Today's agenda, we have introductions, adoption of committee policies, and presentations from staff in the Department of Health and Human Services. That's on our agenda today. I have some housekeeping announcements before we begin. So here we go. First, I want to remind everyone to please silence all of your electronic devices, especially your cell phones and your laptops. We've had a couple of them go off earlier in the day, so please avoid that during the meeting if you can. Members of the public may provide testimony in lots of ways, all of which are listed on the agenda, and today we'll have public comment at the end of the meeting. You may also submit your public comments in writing, either in addition to testifying or in lieu of testifying. Written public comment may be submitted before, during, or up to 24 hours after the meeting adjourns. If you wish to testify in person, please sign in at the table by the door and leave us a business card. Anyone who would like to receive electronic notifications and access to the committee's meeting materials can sign up on Nellis. Members, to ensure an orderly flow of discussion, all comments, questions, and responses must go through the chair. Committee members are also asked to be recognized by the chair before speaking, and that includes follow-up questions just to make sure that we are able to maintain our business timely. When testifying in person, please turn on your microphone to speak and off to listen, as we have others listening to and viewing our meetings online and in Las Vegas. With that, we will move on to introductions. So here we go, introductions of committee members and staff. First, I want to introduce our committee members and those present. So we will start to my right with Vice Chair. If you don't mind, talking a little bit about the district that you represent, introduce yourself, your interests in health and human services, and your goals for this committee.
Thank you, Chair. Such a great honor to be here this afternoon. My name is Yu Wing, and I have the honor to represent Assembly District 8 in the Southwest Las Vegas. Obviously, you see on screen, that's not me. Now it is. Yeah, here I am. Well, I want to make sure that our neighbor were not making funny faces. But I am honored to return to the Assembly Health and Human Services Committee. This is my second session and second term back on Health and Human Services. It's an honor to learn from all of you here, all the colleagues and all the amazing staff. Of course, under the leadership of our new chair, Assemblymember Brown May. In my day job, I get to interact with our Nevadans through my nonprofit endeavors, serving one of the fastest growing community in our state, which is the Asian American, Native Hawaiian Pacific Islander communities, and the diversity that come within that communities where we're not united by anything, even languages, even cultures, and just learning about the different needs that our communities have is very crucial in making Nevada better. So my goal this session is to truly bring everybody together and see how we can move forward. So thank you, Chair, for this opportunity, and I'm glad to be here.
Thank you, Assemblymember Nguyen. Next, we'll go to Assemblymember Orentlicker.
Thank you, Chair, and it's great to be back in Health and Human Services. I'm David Orentlicker, representing Assembly District 20 on the southeast side of Las Vegas. If you're walking east from the UNLV campus, you're in Assembly District 20. My background's in medicine and law. I do a lot of health policy work at UNLV where I teach. So in my 3 terms since I was first elected in 2020, I've been on this committee, and I'm looking forward to working with everybody to make sure we do more to prevent disease when we can and when we can't, to make health care more accessible and affordable.
Thank you. Assemblymember Hunt.
Thank you, Chair. Hi, I'm Assemblymember Hunt, and my district is Assembly District 17 in North Las Vegas. And this is my first session, and I'm so forever grateful to be here and, to learn more about, what is needed and what we can do. And I am a food server, 45-year culinary union member. I got to throw that, I can't help it. And I'm a realtor as well. So I know the importance of healthcare and what is needed. Okay, thank you. Thank you, Chair.
Thank you. Assemblymember Goulding.
Thank you so much. I represent Assembly District 27, which is in the north side of Reno, especially Sun Valley is one of the critical areas of the district, and as well as the West University area of North Reno. I'm delighted to be on HHS. Some of the most important issues that I think that we need to address in the state are access to healthcare and the critical shortage of healthcare providers and mental health care providers. So there's no place I'd rather be. Thank you so much, Madam Chair.
Thank you. We're equally excited to have you. Assemblymember Koenig.
Hello, my name is Greg Koenig. I represent District 38, which is the rural of the rurals, from Fallon to Tonopah. And so healthcare in the rurals is definitely an issue. I'm an optometrist by trade, so this committee, I think, fits right into my wheelhouse, and this is my second time on this committee.
Thank you. Well, welcome back. Assemblymember Edgeworth.
Hello, everyone. I'm Rebecca Edgeworth, and I represent Assembly District 35, which is the southwest of Las Vegas, Southern Highlands, and Mountain's Edge. And I'm very excited to be here. My day job is that I'm a physician, so this is the part that I might actually know a tiny bit about, I hope. This is the first time I've ever been in politics or in the legislature, and I'm really, really excited to be here.
Thank you. We're excited to have you. Assemblymember Dahlia.
Thank you, Chair. Assemblymember Joe Dahlia, representing Assembly District 29 in Henderson. I was raised by a frontline healthcare worker, so I'm intimately aware of how important these issues are, and I'm very excited to be here in my first session on HHS. Thank you.
Thank you. Assemblymember Nadeem.
Thank you, Chair. My name is Hanadi Nadeem, and I represent District 34. I'm committed, I'm very delighted to be here in this committee because I'm committed and passionate about affordable health care. Thank you.
Thank you. Welcome to the committee. Assemblymember Jackson.
Hey, hello. My name is Jovan Jackson. I represent Assembly District 6. That is West Side in Northtown Vegas, very inner city, urban. My background is actually in mental health. I provided mental health services for about a decade to folks on disability, low income. So I'm familiar with the mental health side, and I'm very passionate about healthcare, especially as a cancer survivor. I understand the importance of healthcare and access to healthcare, and I'm very excited to be on this committee.
Thank you. If you don't mind, we'll come back up here to Assemblymember Gray. Welcome.
Good afternoon. My apologies for being late. Ken Gray, I represent Assembly District 39, which is the Central Lyon County corridor, basically from the Lahontan Reservoir all the way up to Lake Tahoe, and then all of Douglas County. So it's a great district. Love it. Very, very pleased to be back on this committee. My background prior to the legislature was on the county commission for Lyon County for about a term and a half, and then prior to that, I was 26 years in the Air Force in military healthcare.
Thank you for that background. Thank you. Assemblymember Hafen.
Well, thank you, Madam Chair. Gregory Hafen II, Assemblyman from Pahrump, Nevada. My related fields in healthcare are, I'm the chairman of the Desert View Hospital Board. My brother's a doctor, my mom's a nurse, my grandfather was a doctor, my dad's an attorney, so I get to see all aspects of healthcare. Looking forward to serving on this for my fourth time.
I think that's a record, four times. Thank you for that. Welcome. Assemblymember Hibbets.
Thank you, Chair. My name is Brian Hibbetson. I'm the Assemblyman from District 13, which encompasses the northwest portion of the Las Vegas Valley, which is Centennial Hills, Sky Canyon, mostly City of Las Vegas, but also the City of North Las Vegas and unincorporated Clark County. I don't have Henderson. My background is in law enforcement. However, I was a licensed EMT, and I grew up as the son of a RN who did 30 years working in our hospital systems. And this is my second term and second time on HHS, and I'm excited to be back. Thank you for having me.
Thank you and welcome. Assembly Member Gonzalez.
Thank you, Chair. Hello, everyone. My name is Cecilia Gonzalez, and I am, contrary to popular belief, excited to be back on HHS. I was trying to get off, and I did not, and so I'm actually very excited to be back, especially over the last year. Some of you may know I recently became a new mother, and that definitely opened my eyes to healthcare, just viewing it differently and needing prenatal care and things like that. And some of the work that we did last session, I have been a beneficiary of, and so I'm very excited to be back on this committee and looking forward to working with all of you. I represent Assembly District 16 down in what used to be Central Vegas. We've just grown so much, and so now I think I'm more west, south, going towards southwest-ish. I have the airport, I have Spring Valley, and then I also have some of like the Sunset Park area. So I'm very excited to be here. Thank you so much.
Thank you. We're excited to have you as well. We won't take that personally about how you tried to get off the committee. I am proud to represent Assembly District 42, Tracy Brown May. This is my third session in the Nevada Assembly, and I've spent the last 20 plus years on the human services side of our healthcare system. So really excited to be able to chair in this capacity and work through some of the very important issues that we've talked about for many, many years here in Nevada. Expectations for how this committee will run. My goal personally as the chair is to ensure that everyone has an opportunity to be heard about the issues that are important and relevant to you. And so I'm excited to continue those conversations and consider the many policy bills that will be before us. Next, we cannot do this alone as committee members. It's really important that we acknowledge our staff and our supporters that will help us get through these committees. So I would like to introduce our committee staff, starting with our committee manager, Ms. Mackenzie Scruggs. Mackenzie?
Hi, Mackenzie Scruggs. Raised in Sparks, have my undergrad at UNR with environmental science, and most recently finished up my master's in public health at the University of Sydney. So just back home and excited to be here. Have thought a lot about equity in terms of health. So excited to kind of explore a new area that is brand new to me. So keen to be working with y'all. Thank you.
Thank you, Mackenzie. We're excited to have you as well. If you'll please welcome Ms. Lori McCleary. Lori, will you wave, please? Thank you. Lori is one of our committee secretaries. This is Ms. McCleary's 7th session, but her first time with Health and Human Services. She's retired from the Nevada Department of Taxation in 2011. So she has a lot of really great expertise. We're very pleased to have her. Next is Ms. Annalise Dankworth. Annalise, thank you. She's another one of our committee secretaries. This is Ms. Dankworth's first session, and her background is in behavioral health research and analysis. So we're excited to have her with us. Our final committee secretary is Ms. Jolyn Smith. Jolyn, thank you. Ms. Smith happily retired on December 13th, 2024 from Nevada's Department of Taxation after 28 years of service to our state. This is her first session serving in this role, and we're excited to have her here. And then I would like to welcome our committee assistant, Ms. Ashley Torres. Ashley, thank you. This is her second session. She hails from California, relocated here to Nevada. She has 2 children, 10 and 14, so she's very, very busy. And she currently works and has taken a leave to be here with us through this session from the Department of Indigent Defense. So we're excited to have Ashley with us. Next is our research policy assistant, Melissa Jimenez. She was raised in Northern Nevada and is proud to call the region home. She earned a bachelor's degree from UNR in criminal justice with a minor in community health services. She's currently pursuing a master's in business administration. She's fluent in Spanish. Ms. Jimenez is passionate about using her skills to support diverse communities. I'd also like you to welcome Ms. Josie Miller, my personal attaché. Josie, if you don't mind.
Hello, everyone. I would like to thank the committee and Chair Brown May for allowing me to introduce myself today. My name is Josie Miller. I am the personal attaché to the chair, and this is my first session with the legislature. Thank you so much.
Thank you, Ms. Miller. It's great to have you here. I appreciate all that you do. Next, I'd like to introduce Mr. David Noss, our committee counsel.
Thank you, Chair. David Noss, Committee Counsel with LCB Legal. Excited to be here. I staffed Assembly HHS as Committee Counsel last session. I've also staffed the Nevada Youth Legislature the last 2 interims and worked on the Interim Legislative Committee on seniors, veterans, and adults with special needs. So excited to be here, serving again on Assembly HHS.
Thank you. We're very happy to have you. And finally, Davis Florence, our committee policy analyst.
Thank you, Chair, and good afternoon, committee. Davis Florence for the record. This is my second session with the LCB, but first with Assembly HHS. I'm born and raised Nevadan from Spring Creek in the northeastern part of the state, and I received both my degrees from the University of Nevada with my master's in public health. And I'm honored to be on the committee and looking forward to a great session. Thank you, Chair.
Thank you. I would like to thank all of our staff and committee members. Our staff in particular, all that they will do to support us throughout this legislative session is going to be really important. And so welcome to all of you and to the committee. So with that, let us get started. So our first order of business following introductions is the adoption of standing committee policies. You all have that document, correct? The committee brief? And we won't necessarily go through each one of these policies. Do you have the policy? This one. 2025 Legislative Committee Policies. I don't, you should have that, members, at your desk. Thank you. It's also available at the table for check-in, so anyone who would like to walk away with a hard copy of it. Okay, the work of the committees is governed by the Assembly standing rules and the joint standing rules that we adopted earlier on Monday. In the full Assembly, the proposed committee policies complement these rules by adding more details for our specific committee. Okay, I won't go through them. You have them all written. Are there questions regarding our committee policies? Seeing no questions, I will entertain a motion to adopt the committee policies for the Assembly Committee on Health and Human Services. Wow. I have a motion by Assemblymember Gonzalez and a second by Assemblymember Gray.
Sure, that works.
Okay, great. Thank you. Are there any comments or discussion on the motion before we vote? None. All those in favor, please say aye.
Aye.
Any opposed? Thank you. The motion carries. Okay, next order of business is our presentation of our committee brief. I will turn this over to our committee policy analyst, Mr. Florence.
Thank you, Chair. Davis Florence, Committee Policy Analyst. For the record, I'm just going to provide a brief overview of the committee brief. Each member should have one before them, as well as it is on Nellis. Before I begin, I would just like to remind the committee that as nonpartisan Legislative Council Bureau staff, I can neither support nor oppose any measure the committee will consider in the next 118 days. I'm just here to provide unbiased policy analysis and research to the chair and members of the committee. So diving into the brief, you will find some statistics on the number of measures that were considered during the 2023 session, an overview of the committee's jurisdiction and potential topics to be considered this session, and a few other relevant resources you might find of interest. So during the 2023 session, the committee considered a total of 94 bills and resolutions, with 69 of those being passed by the legislature and delivered to the governor. The total number of measures varies, but averages to be around 90 bills and resolutions per session. These measures span a broad array of policy issues, including access to care, mental and behavioral health, public health, substance use, and child welfare. The committee brief includes an introduction to some of these topics, with much of that information being discussed and deliberated by the Joint Interim Standing Committee on Health and Human Services. Included in the relevant reports, studies, and audits are the bulletins from the Interim HHS and Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs. These bulletins provide additional insight into the relevant policy areas, along with summaries of the interim BDRs that may be considered by this committee, including Assembly Bill 102, which is an interim HHS bill that has already been referred to this committee. Just to conclude, I would like to remind the committee that I'm available to assist with any issues before the committee, and do not hesitate to reach out with any questions that you may have. Thank you, Chair.
Thank you. I appreciate the presentation. Members, you all have the committee brief that is available for you as well so that you can take it with you. Okay, next, moving on to our next order of business. We have an overview of the Department of Health and Human Services Director's Office. I would welcome Director Whitley. Deputy Director Litz, please take the table and you may begin when you're ready.
Good afternoon, Chair and members of the committee. For the record, my name is Richard Whitley. I serve as the Director for the Department of Health and Human Services, and with me is Shannon Litz. She is the Deputy Director. We're grateful to start things off, and grateful to you, Chair, for reaching out and spending time along the way with each of our divisions in our department and doing a deeper dive. And I realize there are a lot of new legislators, and just as you extended support of your staff, we would extend our assets too in terms of data analytics and those sort of analyses of services that we currently provide. If you, I have a short slide presentation, and then would be available, of course, to answer questions. So starting on slide 2. The department is broken into 5 divisions, and we're a large department. And if from an executive branch perspective and a lifelong public servant, I've seen our department grow over time. We have nearly 7,000 employees. We're the folks that apply for grants and implement the grants and oversee them and deliver some direct services to the population. We really are broken into agencies or divisions that do eligibility, determine through your financial status whether you're eligible for mostly lower income programs. Generally around 200% of the federal poverty level is sort of the mid-range, but with Medicaid, with the expansion around 138% of poverty. But the eligibility is one arm. Over time, that agency has gone to where the people are who don't get enrolled, who can't access online, and you'll hear later in the sessions from some of the folks that work in our welfare division. They do outreach in jails where people are getting out, stabilized a lot of times on medication, but important to get them enrolled or re-enrolled in Medicaid and with an appointment for a provider. So eligibility is a key function that we provide. And then on the other side of that, payer of healthcare, Medicaid, the single largest payer of healthcare, you'll hear from Stacy Weeks, the administrator of that division, on not only on Medicaid as a payer of healthcare, but also an initiative that the governor has put forward in his budget, which is to really break our department into two distinct areas. If you're familiar with Oregon, Washington, New Mexico, they have a health authority concept where they've taken public employee benefits, Medicaid, and really have been able to actually get purchasing power and to monitor quality in ways to really move the dials in their states related to an overall approach to the purchasing of healthcare. You'll hear more on that from her, and also with the exchange. The exchange really is a portal into healthcare for people that are just really fall outside of the Medicaid eligibility. So they truly are people that are working but have either no healthcare coverage, and they can purchase a plan. And the exchange does a really nice job promoting that, and we saw that as a really good fit. We spent the interim looking at lots of configurations and also lessons learned from the other states. So really excited for down the road for you to hear Ms. Weeks' presentation on the Nevada Health Authority. We also put regulatory with that. Currently it's with public health. And if you work in healthcare, you might realize if you're trying to stand something up that the same inspectors, same workforce that will license, and you need a license to get certified in a facility to bill Medicaid and Medicare. So license is essential to come first. We've been smart about integrating those two so that licensure and certification, they're not disparate. The hard part is it's the same workforce that responds to complaints or events that also license new facilities. And we really need to get some of the bureaucracy out of the way that by no one's fault has developed over time. And, a complaint where people are at risk or have harm always goes to the front of the line, and then those new providers, they actually can't bill Medicaid or Medicare until they get certified. And so we've identified some challenges, but also some opportunities with looking at the payer and the regulator being combined. We also, last session, the legislature approved us to put child care licensing with the child care payment for people living in poverty. It's a child care block grant that supports people that are about 200% of poverty or below. But we saw a nice benefit of integrating regulators with the payers of the service because they all had their finger on the same pulse and could move in unison and identify. The goal is the intent is we share the same goal to be compliant. And so if we can intervene early on our regulatory side and get to compliance, that's the goal. It's not a gotcha or a down the road. And so, again, seeing from other states benefits when integrating those two. I probably could just go on about that, but I don't want to steal Stacy Weeks' thunder when she presents because she's done the bulk of the work on this and I think has a really good plan. So those are like oversight or the regulatory and payment, but we also serve, as many of you know, as the state safety net in many ways in providing behavioral health services. Most states across the country have psychiatric hospitals, but they've turned that down as the private sector has stood up private psychiatric hospitals. And most states have the same struggle Nevada does. It's the forensic adult psychiatry where courts have determined that the competency of the individual needs to be evaluated or restored. And currently, you'll hear from, I think on Friday, from mental health folks who can share not only what the status is, but some of the things that are in the budget to address that time delay, because that really takes up time with the criminal justice system that really is a behavioral health challenge. And so that's a direct service. And then we're one of a handful of states that still operate a state as a psychiatric hospital for children in Las Vegas, Desert Willow. And it, as you can imagine, the staffing for hiring clinicians, governments, it's not always, if you hear from Department of Corrections and their medical care or the state-operated skilled nursing facility in Las Vegas, we all have the same challenge. We've all made improvements in our ability to hire, and our vacancy rates have all gone down, but not with clinicians. I mean, there are national shortages and expected to be for a decade, nurses and social workers, and everybody needs them. And so, like like other agencies, like other private sector agencies, we've had to rely on a hybrid of contract and state FTEs. And then really out of the pandemic, learned a lot about like hospitals and nursing homes did, maximizing scopes of practice. It may have been traditionally a nurse's role, but we don't, like others can do those. And so you'll hear, I think in Stacy Weeks' presentation on Medicaid, we had a little utilized reimbursable service, paramedicine, but the rate was too low. So in the governor's budget, he's raised the rate. So hopefully that EMT paramedicine can be utilized in some of the facility settings. Other states have really relied on this, and I think it will help expand the service scope. I mean, I think when we look at workforce shortage, the obvious is to go to. I realize I'm not following my my presentation as I created it. But one of the things that people go to is we need more of that provider we have a shortage of. And not often do we look at like the scope of practice. And, Nevada, the legislature did the hard work years ago with APRNs and independent practice. There was some expansion of independent practice with pharmacists. We only have one pharmacy school in our state, in Las Vegas, Roseman. So looking at some of that expansion of the scope of practice and how that works together, we and again, lessons learned from the pandemic in terms of Nevada had one of the lowest rates of death in nursing homes. We're often cited as having low investment in public health, but we held our own. And some of that is about a decade ago in Nevada, we had an event in Las Vegas where a surgery center, there was reuse of a vial that was contaminated and infected people got infected with hepatitis C as a result. It's totally not only transformed Nevada with our healthcare approach and our regulatory approach, but also the country. And CDC took a big hand in like monitoring healthcare acquired infections. But one of the things that we did that I'm so grateful for is rather than have regulators go after nursing homes when they like have an event that could have been prevented, like healthcare acquired infections, we actually added to our epidemiology, facility-based epidemiologists, to just be helpful and to like go in not with a clipboard and not to cite the facility, but to actually create a culture where they could ask a question and not feel like there would be a gotcha on it. And it really was a culture change that I don't know when exactly, but we tested it during the pandemic, and where we saw issues in nursing homes where across the country where most of the deaths occurred in facility-based deaths in those settings. And Nevada, there was a time where we had the second lowest death rate among residents in facilities. Every death is tragic, but that infection control that was stood up and maintained was so valuable to us. So sometimes without resource, just learning from events and actually memorializing it and continue to support it can be a change agent. And so it's a lesson I think that I learned and we're trying to digest what we've learned out of the pandemic with our workforce, with our facilities. And so some of those things, if you sit on the budget committees, you'll hear. Some of them have policy impacts. I am hopeful that you'll look at any scope, if any scopes of practice, maybe that's not in this committee, but it is important to the health of people that they have access. You can have health insurance, but not have health care. And so one of the other items that we are proud of is that in 2012, when Governor Sandoval, the first Republican governor to expand Medicaid, did it thoughtfully and impactfully. And so our uninsured rate is now like at less than 10%. I mean, it's been huge, but we still have the access issue. So we still have workforce shortages. So that has to be tackled, I think, as the secondary piece to this. I mean, coverage, doing all that we can to get people covered, but if they have nowhere to go, primary care is an area where we know we have a shortage. So our agency does all these things really big. You're going to hear it broken out over the next few weeks in terms of deeper dives in each area. I did, in our office, we oversee the opioids. We have two big funding sources, opioid settlement and tobacco settlement. Tobacco settlement is called Fund for Healthy Nevada, and it's in perpetuity. So as long as people are smoking, we get a % from the tax. That was, I think, back when Frankie Sue Del Papa was the Attorney General. The settlement landed so that it's in perpetuity. It's gone down slightly, which is good. People are not smoking. I think if you sit on the taxation committee, you'll hear that those revenues are down too. But it is in perpetuity. The opioid settlement, we get a % of the settlement that goes, and so do local cities and counties. And there's legislation from 2021 that allows us to set priorities and roll out the funding to mitigate the harm that was done. And as most of you know, probably, like the levers were put in place to reduce the prescription of opioids. So people have naturally moved to other drugs, illicit drugs, and so it really is substance abuse in a generalized way that I think is an outcome of that, and definitely in a couple of spaces. In the interim, we probably go to every interim finance committee because the legislation on these funds allow us to, and things emerge that I'm grateful that we don't have to wait 2 years to address a problem, but we have a significant problem in our state with gestational substance use with harm to children, which I have our state biostatistician, she came with us, her name's Maddie, and she did a report that is on our dashboard that on gestational exposure. We continue to increase in pregnant women who use substances from illicit drugs to alcohol has gone up, marijuana, and harm that's done. And then we see the downstream impacts. If any of you have backgrounds in public health and surveillance where you go upstream to identify the cause or the source of the problem, if you need only go to a juvenile court or a child welfare briefing to identify where various systems perhaps failed or missed opportunities occur. And we have a really nice report, and we've been funding off that in terms of awarding funding. Still have a huge issue in Las Vegas and Clark County with getting the services for women who are high risk into prenatal care and keeping them there. In contrast, in northern Nevada, Renown Hospital System was originally Washoe County Med. It was a county hospital, and they stood up a women's center that does LARC outreach, long-acting reversible contraceptive outreach. They do cancer screening for women and also prenatal care in partnership with UNLV. It's a wonderful program. If you have, we actually brought folks from Clark County up to see it, and then tried to put out an RFP to get takers on doing something in this space. I believe UMC should take a role as a county hospital, but I'll continue to persist. The need is there. The data shows the problem, and you can you can predict what's going to happen. I mean, and some of these children are neurologically damaged from the use of substances, and it's preventable. You know, we can stand up more services on the back end, but we have to do both. These should be never events that we could intervene with. So, if any of you have any bills on those that are, or any interest and want to take a deeper dive, Maddie, our biostatistician, she can pull out by race or ethnicity or age, geographical, where people reside in the past. And I don't know if we've stood this up yet, but we did health status report cards for each of your districts, you know, on what diseases and what, you know, what is occurring with the population that you're representing. And would be happy to at some point go through that, or have Maddie, you know, walk through what that means. But a lot of this, you know, is preventable, or at least could be intervened with. And I'm hopeful that if you have an interest in that in any legislation or bills, that you talk with us. I mean, you know, not to sound like I'm not jaded by any means. I stay enthusiastic, but there's a part in this legislative process where there's not enough money for everything, and everybody wants their fiscal note removed. And so I'm just suggesting that if you have a health bill and want to talk to us, like talking now, we do our day jobs on the work we do, but we also believe in the work, and you're going to hear that through all the presentations that we have, that the people that we have, you know, are here because they believe in the work they do. And coming out of the pandemic, which wasn't easy, you know, they still are rebuilding or establishing new, or have lessons learned that they're acting upon. So grateful to be here, and would be happy to answer any questions.
Thank you, Director Whitley. Before I open it up for questions, do you want to run through a couple of the slides? Maybe Deputy Director Litz, maybe?
For the record, Richard Whitley, I really did hit the topics that were in there. And it's not because of the way she wrote them up. I really just, it's, you know, if I look up and you seem engaged, I am trying to provide the information that is engaging. And most of this information is on our website. I would encourage you to go. Probably where we're not good is at promoting what it is we do, but the work that Maddie and her team in data analytics have done, it's remarkable work, and it's not just wallowing in a problem. It really is strategically suggesting where we can go. She did a wonderful report that is posted, that taking DMV data and height and weight, self-reported, probably underreported, matching it with Medicaid spend on obesity, and SNAP, which has no restrictions on the food you can purchase. None. WIC does, but SNAP does not. And you know, showing that we have higher rates of obesity and other health conditions with a population that we might have some ability to influence and do something about. Where no controls on food, but then we are seeing the healthcare issues that come about from being overweight and obese. And so we are trying to tackle that as a large issue. But there are some really good reports. There's one on, if you're interested, on the social service side. It's a requirement in statute that Senator Kinsella put forward that requires us to identify the top employers with employees who are on Medicaid, and the state of Nevada is on there. And we know, you know, we have a lot of single moms. My department is the #1 department. The Division of Welfare and Supportive Services is the #1 division. part of that is because they recruit consumers to become employees as a step out of poverty. You know, the usual employers, Walmart, Amazon, number 1 and 2. Clark County School District is in the top 10 on there also. I imagine the same thing with the state, a lot of single moms. So what can we do about that? There's data that tells us in doing town halls, like with our own employees, we've identified that they get stuck. And so what are their career paths? Like getting a job is one thing, but if you're a single mom with 3 kids, you can do the math and know what you need to make to move out of poverty. So how do we help them get there? Part of our reorganization is that we can focus on, I think I mentioned early on, about 200% of poverty is sort of where a lot of the nexus for a lot of our programs, WIC, child care, certainly covered by Medicaid or Nevada Checkup, the children's program. But some interesting things where, I mean, these could be winnable battles. We have people who are on Medicaid, but clearly like have either gotten a promotion or someone in their household is working more and they no longer are covered as a family on Medicaid, but the children are covered in the checkup program. And watching that small population go back and forth or go back, why? I'm very excited to maybe not retire right away, to be able to actually tackle that issue and helping move people out of poverty and trying to demonstrate it with our own staff now in terms of even like how you know, here's where you would need to be to actually move ahead. How do we get you there? And how long is it before you can get there? That was some of the feedback that we heard from our own employees. I mean, if I can do that, maybe then reaching out to the other top 10 employers and seeing what we can do. Because just getting a job isn't enough. It is like, how do you support your family and have a graduated way to move out of poverty? And so I really, having that sort of focus in our programs might come to you next session with a proposal to reconfigure some of those programs, especially when it comes to populations like children. I mentioned our opioid settlement funds and trying to intervene with prenatal care and also children. You know, the studies all show that if you can break poverty with kids and launch them, you know, you can really end generational poverty. And so we have a lot of the tools already and just want to make sure that we can maximize them. So that's the other side of Health and Human Services, the human service side that doesn't get maybe as much focus as the healthcare side does. But I think I'm good with that I covered everything that was in the presentation.
Thank you, Director Whitley. I appreciate that. We do have a number of new members that are on this committee. As we all start to learn about what is DHHS and the divisions that break down. Members, I'd like you all to know that over the course of the next couple of weeks in particular, we're going to hear from the leaders of each of the divisions that report up currently through the Division of Health and Human Services and Director Whitley. So you'll have an opportunity to get into each one of those divisions going forward in the next couple of weeks. But for now, does anyone have questions? Oh, I do have one. Assemblymember Nadeem.
Thank you so much, Madam Chair. Thank you, Director. So my question is that do we cover, the Medicaid covers any program for the postnatal visit to the mothers?
For the record, Richard Whitley. I believe so, but I that would be best answered by the Medicaid administrator. But I believe that we do for if the recipient is eligible, then yes, of course. There was some legislation previously about covering women who are not currently documented in the state or in the country to cover the child and some of the prenatal and postnatal care. So I don't want to get it wrong, but if they're eligible for Medicaid, then yes, they are covered.
Okay, thank you.
Thank you. Members, anyone else? Okay, seeing no other questions, I'm going to say thank you, Director Whitley, Deputy Director Litz. We're thrilled to have had you here for this brief introduction. We look forward to seeing you and your staff going forward, and we look forward to working with you throughout session. Thank you so much for being here today. Okay, with that, members, we're going to move into public comment. Quick agenda today. To provide public comment, you may call 888-475-4499 if you are online, and then when prompted, provide the meeting ID. Enter 850-9574-1563, and then press the pound sign when prompted. I just want to make sure that we put that out there, as I know we have a number of folks who listen in on this committee that have very diverse needs, so I'm going to say that telephone number one more time. To provide public comment or testimony on the phone, please call 888-475-4499 and then enter the meeting ID when prompted, 850-9574-1563. If we have anyone here in the room who would like to provide public comment, please take the table up here in Carson City or in Las Vegas. Seeing no one up here in Carson City wanting to offer public comment and no one in Las Vegas, let's go to the telephone lines. Do we have anyone who has called in to offer public comment?
Chair, the public line is open and working, but there are no callers at this time.
Thank you very much. Members, before we close today's meeting, does anyone have comments that they would like to make for the record? Okay, did you all eat a heavy lunch today? Thank you so much. You don't have to offer a comment. We just wanted to make sure that we gave everybody an opportunity to feel heard today. Welcome to the very first meeting. We look forward to a robust session. And that concludes our meeting for today. Our next meeting is on Friday, February 7th at 1:30. This meeting is adjourned.